This is a part of the Ask Me Anything series about COVID-19. I am with Dr. Ross Kauffman, an epidemiologist and director of public health at Ohio Northern University. What would be the criteria for allowing society to return to not having social distancing, mask wearing, and enhanced disinfecting practices in place? Obviously, hand washing and basic hygiene practices should be continued. But is there any exit criteria for the measures put in place for COVID-19?
This is an excellent question. I think the target we are aiming for is the establishment and maintenance of herd immunity in order to return to normal. That is, when there are enough immune individuals in a population to prevent susceptible and infected individuals from coming into regular contact and thus halting the spread of the disease. This will most likely come from the development and administration of a safe and effective vaccine to a large percentage of the population. Significant efforts are underway to accelerate the process of vaccine development, but we are likely still months away from the development, mass production, and distribution of such a vaccine. The other alternative is waiting for enough individuals to develop natural immunity via infection to achieve herd immunity. However, the human and economic costs of such an outcome would be significant. Also, it is not clear how long natural immunity might last. Immunity to some of the other coronaviruses fades after several years, meaning that achieving herd immunity through natural infection may not even be possible. When we look at the experiences of other nations with past outbreaks, it appears likely that some of the cultural changes we are making may well become permanent. For example, experiences with SARS have contributed to an ongoing culture of mask wearing in many parts of Asia, especially during cold and flu season. Hopefully, these new habits will help us better control old challenges like seasonal influenza and be better prepared for the next pandemic when it comes. Additionally, I hope that this pandemic will spur us to develop better forms of personal protective equipment, like more comfortable, fashionable, and effective masks that will make it easier to continue best infection control practices moving forward.